your professional background and having worked in the private sector in healthcare. And one of the issues that probably might have come to attention is the ills that bedeviled the defunct NHIF. And the move by government, and I'm certain you may have taken keen interest on the Social Health Insurance Fund and the challenges that are there now with the Social Health Insurance Fund. One of the problems that we've had with the NHIF is collusion between staff at NHIF and private medical care providers, unfortunately including faith-based ones. And we have seen exposés in the media of very small private hospitals raking in millions, hundreds of millions from NHIF. I would want to hear what, having looked at SHIF, which I'm certain you must have looked into, what are the measures you intend to put in place should you be approved? One, to curb the theft that has been witnessed in NHIF by both the public and private medical practitioners, especially owners of private hospitals. Two, how do you intend to leverage on technology to ensure, one, that you bring down the cost of healthcare in this country? There are hospitals that will charge NHIF 200 shillings for paracetamol. There are others within the same vicinity that will charge the same fund 30 to 50 shillings. How do you intend to utilize technology to curb some of those things?
You may proceed to answer.
Thank you, Honorable Member, for raising the concerns, and indeed I understand and have interacted with various Kenyans that have raised the very same concern. First of all, my approach is a consultative approach involving the multiple stakeholders, from the PSS, Director General, the National Technical Working Groups, the NHIF, among others, including the community who are receiving the services. And with this, we need to conduct a situational analysis to understand the challenges, and from there come up with interventions and action plans. But from an outside view and working in various organizations, I have seen the strength of having processes and procedures, of which I believe the government has, and we need to strengthen this. One of the ways is using a digital platform that will reduce the human-to-human interaction and will be able to monitor challenges. And this needs to be implemented first on a phased approach, but ultimately at a national level. And that way, we'll be able to monitor various services that have been given. We'll be able to monitor the quality. We'll also monitor the prices, the stockouts, etc. So I believe it's critical that we embrace the digital platform as Kenyans. Again, transparency and accountability frameworks are critical, so we need to look into this, and I believe that the National Technical Working Group is really competent, having interacted with them in the WHO environment, and I think we can work together with the multi-sectoral approach to ensure that we have transparency and accountability, open tenders, among others. We may also consider using external bodies to monitor and ensure that we have no challenges in that. And leveraging on technologies, I believe it's time that Kenyans embrace telemedicine and also embrace the digital platform as discussed earlier.
Junet.
Thank you, Chairman. Chairman, my question to Dr. Debra is, Madam Nominee, as you are aware, health is majorly a devolved function. Health matters happen at the county level. But the problem this country has encountered for the last 10 years or so, since the new constitution and that devolved health